Now I would like to invite Dr. Pavani to share her thoughts and experience in dental and wellness. Thank you. Dr. Unmute.
Thank you so much. It was a very elaborate presentation by Rakshita, and it was very informative presentation by Mrs. Balaji. And thanks for giving me this opportunity from Daffodil Health and also MedPiper. So today I was given to talk about oral health among autism children. So let's celebrate the good doctor. If you have seen this Netflix series, Sean, and it's all about autistic community. So I'm Dr. Pavani, a Pediatric, Myofunctional Orthodontist and special care dentist. So for a lot of dentists or people who wanted to know, the topic today I'm covering about what is the criteria to segregate the patients when they are coming to your clinic, and what are the drugs that affect oral health which autistic child is using, and what are the most dental problems you encounter in them, what are the other kind of oral hygiene aids that can employ to help in maintenance of oral hygiene, and what kind of environment you can set up to welcome such children, and what is the behavior management you can employ, and what are the controversial treatments which we are regularly using for other children, which you should not use in such child. So the diagnostic criteria with that is qualitative impairment in social interaction, marked impairment in the use of multiple non-verbal behaviors such as eye-to-eye contact or facial expression, body posture, or gestures to regulate social interaction. Because a lot of us do not know, dentists have to segregate the behavior, and it is very offensive for the parents who are visiting a dental clinic to tell them directly that your child is autistic or not. So many of the parents don't admit because they feel that it's a dentist. Why do we need to disclose the behavior of the child? It is very important because a lot of things will change. Our treatment plan, everything will change. And also dentists should be aware of how to segregate these criteria. For the dentist, you can go and see this NAPC criteria so that it is easy for us to segregate. If the child is having 1, 2, 3, okay, and 1 is compulsory, and anyone from second and third category, if one of thing you see, you can categorize them into an autistic child. So I don't want to go into the details because depending upon the numbers who have present, I don't think they need a lot of information about NAPC guidelines or criteria. So what are the drugs that affect the oral health of a child? The CNS stimulants like methylphenidate and antipsychotics, clozapine and olanzapine, antidepressants or anticonvulsants, carbamazepine, and antihypertensive clonidine, which will cause mostly the xerostomia, that is dryness of the mouth, or dysphagia, difficulty in swallowing, and tongue edema, gum, gingivitis, gum swellings, and also sialoadenitis, that is inflammation of the salivary glands, or discolored tongue, or also bruxism. Bruxism is the kind of rubbing the teeth against each. So all these things can happen because of the drugs they are using. Depending upon, most of the drugs will cause xerostomia, that is dryness of the mouth. When the mouth is dried up, there is less saliva secreted, and saliva has fluoride, which will help in reducing the cavities. But because of xerostomia, the cavity will increase in such children who are under medical treatment for the same. So what are the dental problems you see? One is the eruption. Mostly these people have delayed eruption due to gingival hypertrophy, which is caused by a drug called phenytoin. So you should also know about what kind of drugs they are using. Yes, which is caused by phenytoin. So, and you can, that is the eruption problems. So mostly these children have little delayed eruption when they are using a drug called phenytoin. And what are the gum diseases you encounter in institutionalized autistic individuals who had higher frequency and more serious periodontal problems? They exhibit lower cavities, but more of periodontal problems. And because of unique fixation of the diet and preferences for low textured food by these autistic can contribute to low incidence of caries in such institutionalized individuals, because the similar kind of diet and their preferences also like low textured. It is according to Chandrasekhar et al. But other people who observed there is increased caries in such children. Okay, as children with autism have very poor tongue control, they cannot able to control the tongue, so the tongue coordination is difficult, and usually they prefer soft and sweetened foods, tend to pouch the food for a long time inside the mouth, and their preference also depends upon the food and texture. They prefer to maintain it for a longer time of when the rule of 20 minutes, that is the food should stay for in the mouth for only 20 minutes. More than 20 minutes, the pH, that is the acidity in the mouth increases. When the acidity increases, automatically the demineralization, that is dissolving capacity of the tooth, will happen. So and also there is difficulties with them in brushing and flossing because of the lack of motor coordination, and parents as such for a normal child also should able to assist them in till 6 years for motor skill development of brushing. Okay, whereas such autistic child, when you tell, as already Rakshita has explained about how she felt in the morning when parent tells about brushing, where is the brush? They have lost what they wanted to do. So it should be told in steps, and you should have a lot of patience to tell them. Okay, and parents should develop a patience, because their old is different from what you see from the other children. So it is not very easy, because if you start using voice control, it will trigger more autistic characters. So I tend to do reinforcement in here in this toothbrushing technique, where it should be joyful and what kind of mode setting it should be there. For a normal child, there will be bright light or something where the child can cope up. But whereas a bright light can also trigger them to aversion. So sound, a loud sound or bright light, everything should be in minimal, and use a dim lighting setting. And a kind of when you go to a diner, how do you expect the aesthetics? In a similar way, you have to set up your home in such a way that it is very encouraging for the child to take up a brush and brush on his or her own way. So it should be told in steps, like first take a brush and then apply a paste, not everything at a once, that you do not tell them what you are doing, like take a brush, put paste on your own and then just force them to brush, doesn't work. So you have to break the brushing technique in smaller steps, so they will tend to do, they will be encouraged to maintain the oral hygiene. Okay, if it in case of severe children, it is difficult, whereas in moderate and mild child, it is obviously very easy when you know about how to do the behavior management. Autistic child with high IQ is even more easier to tackle with. So a low preference of dental caries again was mentioned. It is different from different populations, how it is being done and what kind of people they are assessing. Because some people in institutionalized people, as the food is fixed, there is low level of dental caries. But in a setup where the child is more pampered, given whatever they like, for example, in a well-to-do family, they tend to give soft, sweetened foods more likely, so that they think that can calm down the child, so which will cause more cavities. Once this kind of cavities happens, then it is very difficult for a dentist to treat. So it is better to prevent. So what the prevention also is different from a normal individual. I will go into that in the coming slides. So it is caries and overall depends upon the population where there are put up. It increases in well-established homes, and it decreases in institutionalized homes. And what are the oral hygiene aids you can employ? A toothpaste which has no taste or less taste or mild taste. Don't give what you like, because you might like mint or a lot of mint in your paste, or dabur paste, which will actually irritate the mouth. So very strong stimulus will not be liked by autistic child. So give a mild toothpaste, GC Toothmousse Plus, which is very mild in mild toothpaste, which doesn't have a lot of strong taste or odor, will help in acceptance by the autistic child. And brushes, see, a strong brush usually will irritate the grip, and they do not want to hold anything very strong. So something has to be very soft for them, so which they can feel and do. And as they don't have a lot of dexterity, so you can use a three-phased bristles, which will cover all the surface and then get it clean. Or it also helps in encouraging them to do it, because it's different from what usually the parents have. So you can show your brush and their brush and say them that's different. So they tend to like it more and they wanted to do it more. And if you don't have a modified brush, you can take a sponge at home and wrap it around the brush, or a ball, that stress ball is there. No, you can actually take a stress ball, make a dig in the hole and ask them to hold it, which actually helps them to de-stress themselves and also helps in motivating the brushing. So that is about all about brushing and what kind of paste and brush to be used. And dental clinics setup as such should not have any distracting stimulus like sound, light, or kind of taste. When they come into the hospital, don't try to give any kind of strong welcoming drink, or the smell which you have in the clinic also should be very sensitive. Don't use high perfumes which will distract them. So have a different setup room for them to do the procedures. And introduction of relight conditions, rhythmic music, and deep pressure in the dental setting will help in reducing their triggers or reactions towards a very active environment. And you can start with a small simple procedures, break down into simple steps, and then try to do it. So even the parents have to be prepared before taking them to the hospital. Do a pre-workup saying that what they are going to do, what kind of setup it is, and who is the doctor. Show them, make them familiar, so that the child will not feel isolated or strange in the new place. So the parents also should coordinate much before with the dentist when you are fixing an appointment, and tell them which time is ideal for the child to walk in. So it may be feasible to treat the child in a calm, secured sole operatory with reduced decoration and dimmed light. There should not be heavy lights, and a single operating room should be dedicated to accommodate the treatment of a autistic child. And appointment rules, and you should not make them wait for more than 10 to 15 minutes, because they tend to have very limited attention span. So don't let the child wait for a more time, and don't expect him or her to cooperate in your dental chair. So even the parents should able to bring the child on time, not missing the appointment time. If they miss the appointment time, if the doctor takes the next case, then the child will obviously have a negative behavior on the dental chair, because we are not just giving a shot, we are doing some treatments. So autistic individual preferences for sameness, aversion to change, a routine should be established by maintaining days, time, and personnel for each dental visit. You should not keep changing your junior dental doctor who is attending, or a dental assistant who is assisting, or the reception staff who is welcoming the child. The same staff should be there each time the child comes. And also make sure that dental environment is the same for him, not changing his operating room from one place to another place. And because they don't like a change, they wanted to have a routine in their activities. So any actual procedure, what you are going to do should not be discussed and should be avoided with the child, because it creates a kind of anxiety in the child. So, and what is the role of a dental assistant? Dental assistant is the first person to meet the patient or the child. So the assistant should be able to identify what are the triggering points and should mention the same to the doctor. So the doctor is well aware of all the deviant reactions given by the child towards a triggering point. So he will make sure, because in dental clinic, we want to see what is happening in the mouth. So we need bright light. When we are focusing the bright light onto your child, definitely you have to use the distraction goggles. Otherwise, the child will get into a negative behavior and you cannot finish the treatment plan. So the behavior management, tell, show, do, modeling, smaller steps, you have to break down into smaller steps. Let them do it, because they are intelligent. They know everything. Just the way of their perception is different from others. So they perceive with touch. They perceive things with biting or tasting, or they perceive things in a different way when compared to. So you should be knowing what kind of children are they and how to do the technique. And picture exchange communication system, because you show them these and ask them what they want, what they see, and how to tell thank you. So you ask them to pick up these things. Picture exchange communication system is better, not the mnemonics which we use like rain. You cannot say for a child where you are applying a rubber dam frame and telling the child that I'm using a raincoat. Okay, because here you have to actually show them something visually, because they are more visually excited, and visual acceptance is more. So show them your communication in terms of pictures, which will help them to understand it. And physical restraint, this is how I restrain the child before doing a procedure to do a root canal. See, when I am not talking, but the mother is keep on talking, which actually increases the anxiety on the child. How much ever I tell to the parents, they won't understand. They think the child is undergoing something. They don't like loud sounds or talking or soothing in continuous phrases. They want very calm, soothing words rather than, and again, there is a sound. So much sound. Actually, the physical restraints, okay, help in providing a predictable working condition where the child is safe, okay, because everything what we are using is sharp. So sometimes the restraint bone can calm down in a dental setting. Deep touch actually have a very soothing effect, whereas light pat can irritate them like hell. So they can be wrapped in blankets, applying tight, so they know the boundaries of their body, and it has a soothing effect. But the parents will not understand this thing, and they think that the child is undergoing some kind of pressure or some kind of restraint. They feel they have to talk. If they talk continuously, that is what is irritating them. So reinforcements, you can actually initiate or terminate any kind of stimulus, that is the response from the child, with positive or negative reinforcement. For me, a negative reinforce like drilling can handled by doing the procedure for treat. For example, if I am doing a hole, it creates a sound. I cannot reduce that sound because there is nothing called, for example, it needs little invasive procedure. Otherwise, we can use carry salt, which will dissolve the cavity for minor fillings. But whereas if you are doing a root canal, you need to get into the chamber. For such teeth, especially, you can tell them that I will take out the drill in 10 seconds. Just count down 1, 2, 3, 4, 5, 6. So they will try to bring, and then you are supplementing with a reinforcement saying that I am taking it out. Okay, so that I will get a desired behavior. That is, the child has to calm down. When the child needs to calm down and he has a whining behavior or keep on shouting or becoming restless, in that way, just tell them that I'm going to take away the drill if you become calm. Okay, so only give instruction one or twice, not too many times telling the same thing again and again, because that is not going to reinforce anything. The sequence of events is repeated till the procedure is completed. Like you are going to do this in a smaller steps, repeating the same procedure again and again till the procedure is completed, so that the child will adjust to the routine. Nitrous oxide, usually it is a sedation kind of thing, where you give nitrous oxide to the child, where the child falls asleep or like consciously he is awake, and you can able to do the procedure. You need to give longer duration and higher concentration to achieve desired level of sedation when compared to the other individuals. And fluoride varnish, this is fluoride varnish. This is a normal child, not an autistic child, where we are applying a fluoride gel and cavities. It is applied in a foam tray. So what happens in foam tray is it is soft, they can able to take. Can we apply this in autistic child? No, because usually they say gastrointestinal association with autism is there, new theories saying that the gut microbiome and the leaky gut is actually causing the autism. Okay, so the microbe has to be changed on the leaky gut. So when there is a leaky gut, and when there is fluoride, which if they swallow, because you cannot control the swallowing in a child, which will serve as a neurotoxin and can increase autistic futures more. So fluoride application in autistic patients is very controversial. Unless it is much needed in very high risk patients, you can apply in controlled way using a rubber dam at least, so that they won't swallow, and it is only applied onto the tooth. And which restoration is more acceptable? The white restoration which you are seeing is composite, and the black restoration which you are seeing is amalgam. Amalgam is more durable and preferred when compared to composite, because composite has bisphenol A, which is endocrine disruptor, and which is again controversial in using for autistic child. Thank you. I wanted to finish off this class in short time, so I finished a little sooner. So this is my email ID and this is my number. You can note down and contact me for any doubts.
Thank you, Dr. Pavani. I did great presentation on dental care. Since we are running late of time, we are thinking to take the Q&A offline. So I would request all the participants who have got any doubt can call me or message me. I will share the questions to the concerned speaker. I would like to thank the speakers today for joining us on a Friday evening and sharing their experiences in connecting with autism. And thank you, Daffodil Health, for the continued support in doing such kind of special programs for the doctors and also for the the parents as well. Have a good evening. Thank you.